Hi, I'm Dr. Marie Chiasson from the Andrew Weil Center for Integrative Medicine. Today I want to talk to you about the benefits of guided imagery. Guided imagery is a directed, deliberate daydream or imagination experience that has deep health benefits. It's different than straight visualization because with your imagination, you're using all of your senses to create an experience. And in fact, research has shown that imagining an experience is almost as good as having it, not quite as good. So I'll give you an example. The Japanese prescribe something called forest bathing or Shinrin Yoku to decrease anxiety, stress, and blood pressure. Using guided imagery to visualize and imagine with all your senses walking through a forest can have similar benefits. So today I'm going to talk to you about the benefits of guided imagery, and then I'm going to take you into a very brief experience of forest bathing through guided imagery. So we know that guided imagery works on the brain very similarly to hypnosis and meditation. It increases activity in the anterior cingulate cortex and also in the prefrontal cortex. Both these areas of the brain are known to turn down a little in chronic stress, chronic pain, and in chronic illness, anything that's sort of a repeat stressor that happens to you over and over again. So for most of my patients and for myself, I use guided imagery as a way of turning back the anterior cingulate cortex, turning it back on, and same with the prefrontal cortex. And brain scans have shown that this is how guided imagery works. So I find that quite interesting and very useful to have this internal tool that I can use at any time. The data shows that it helps with mental health and optimism, and that is a wonderful impact in my life. It also has been shown to work with acute pain, chronic pain, asthma, COPD, cardiac disease, osteoarthritis. There's really a variety of health benefits that have been proven through research on guided imagery. The only person who shouldn't be using guided imagery is someone who starts doing guided imagery and feels more anxious. If you find that you feel more stressed and more anxious, then just stop. We don't want to use it if it's making you more anxious. We want it to be something that you find relaxing. So I would never impose guided imagery practice on someone who didn't want to do it. There are a couple of other things I want to talk about before we get started. The first is resources that you can use that are easily available to you. So if you like what we do today and you're interested in guided imagery as a mind-body practice, there is a resource called Insight Timer, which is a phone app or a website on the computer that you can find, Insight, INSIGHT, Timer. And there are literally thousands of recorded meditations, hypnosis, and guided imagery pieces that you can use, so it'll be easy to find one that you like. Also, there's one of the oldest and best teachers of guided imagery is a woman named Belruth Naprastak, and her website is healthjourneys.com. And she's offering free guided imagery right now, which would be free.healthjourneys.com. Belruth has the best description of guided imagery I know. She calls it the lazy person's meditation. And since so much of the population has difficulty sitting down and meditating, for people who can't meditate, I suggest that they add a guided imagery practice to their daily routine. I would use it every day. There are also other sites like Headspace and Calm. They all have guided imagery pieces that are really useful. The last thing I want to tell you, which is something I find amazing, is that guided imagery has been shown to work while we're sleeping or even in the operating room under anesthesia. They've played guided imagery and suggestive pieces in someone with headphones and have found that it can decrease bleeding time and also has helped people get out of the hospital more quickly. So it's pretty powerful what the mind and the body can do together. And with our imagination in this piece, we're going to use the mind and bodily sensation. So I think that's the beginning. That was the introduction. And now here's the map. I'm going to turn on some music and just gently walk you through a forest. So what you need to do while I turn on the music is to find a comfortable place to sit or lay down. I'm just turning on the music right now. And get yourself really comfortable and in a position that you feel safe. So I want you to feel safe. And this is a very safe technique. All you have to do, if you don't like what's happening, is open your eyes. You can stop it at any time. Okay, so we'll begin. So in whatever position you've chosen, I want you to close your eyes. And as you close your eyes, begin to notice your breath. At the end of every exhale, before the inhale, there's a second or two where you come to complete rest. And I want you for the next 4 breaths to rest in that place after the exhale and before the next inhale. There's nothing to do. The body comes to a full stop, and I want you to pause and relax in that space. Now, in your mind's eye, I want you to see yourself at the edge of a forest, a very safe and welcoming forest. See a forest that you like, that you would want to walk into. And notice at the edge of this forest, there's a path inviting you to come in, a welcoming path. And with your imagination and with a quiet breath, I want you to begin to walk down that path. Notice how the earth feels under your feet. Notice the sound of the forest, of the birds, and the wind in the trees. And look around and see what you can see. Now look up and notice the dappled light of the sun coming through the canopy of the forest. And look around and see what else you can see. Take a deep breath in and smell the forest. So you're noticing how your body feels, your feet on the ground as you're walking through. Now begin to walk through the forest and look around. I want you to look for a tree that seems welcoming to you. Noticing the birds, perhaps the wind on your skin. And look around until you find this tree. And as you've used your imagination to find a tree, I want you to walk up to the tree and just rest your hand on it. See how it feels under your hand, how the bark feels. Notice how tall the tree is. And now I want you to sit down at the tree's base and lean up against it and look around, noticing the greenness and the light and the birds. And just relax up against the tree and listen to the forest around you. Breathing in the fresh air and noticing the support of the tree on your back. Now, if you want, you can stay seated at this tree's base, or you can stand up and continue your walk. But as you do, listen even more deeply to the sound of the forest. Breathing even more deeply, noticing the smells around you. And using your eyes to look around and see what you notice. Really noticing nature. Being present with nature in this safe forest that you've created. And as this is a short guided visualization, I want you now just to thank the forest and say goodbye. In any way that you like. And slowly open your eyes and come back to your home where you are. And look around. Slowly coming back into the here and now. That was a very short taste, just to give you the idea of whether or not you want to give this a try. Very safe, very easy, very full of health benefits. So I want to encourage you to get on Insight Timer or healthjourneys.com or Headspace or any of the ones that you find that you like. And if you really get interested in this, you can get on to the American Society of Clinical Hypnosis site, ASCH, and they will also teach you more. Okay, so that's what I had to share with you today, guided imagery. As Belle Ruth Naparstak would say, the lazy person's meditation. And I hope you enjoy it. I suggest at least 5 minutes a day. And if you have time, 15. All right, be well. Thanks.